Ever had questions regarding health of your loved ones and didn't know where to get your answers from? VServe presents Know Your Health, a podcast that gets experts in healthcare to talk about specialities like never before. Stay tuned. Our guest today is someone who understands that patient connect and treatment goes hand in hand. Someone who treats the most critical ailment, cancer. He's been practicing for over 10 years and has treated over 1000 patients. Please welcome Dr. Jimmy Mirani. Thank you, Dr. Jimmy, for being here and taking your time to, talk about oncology with us.
No, it's always a pleasure, to be here and just end up talking to you and talking to anyone, in fact.
Right.
Because usually we always end up talking about, if I meet my colleagues, I'm always talking about, what medicines, this, that.
True.
Today, when I just know this, it's like sort of different,
Yes.
So that's what.
Just thought of, having something started because people today are really unaware of what exactly needs to be done. And oncology being a very specific subject and very heavy as a topic, people don't generally discuss them in detail.
That's absolutely true. That
Yeah.
is so true. You're right about that.
Yeah. So, which is why I thought, might as well have something which helps the audience and the patients, in fact, to understand where to start and just to ease out on the topic, if nothing less.
Correct.
So, the first question, I'm sure, everybody has asked you this, and you may have been tired answering this question. Why oncology?
Frankly speaking, no one has asked me this question. Okay, so
Okay.
to start up with that.
Yeah.
So here's the scenario. When I did my MD medicine back in the days,
Yeah.
I was always more keen towards the medical side
Correct.
rather than the surgical side.
Yeah.
That was me per se.
Okay.
Once MD medicine was done, I was very sorted and very like I was sure like this is the way I want to go. And that's when I started realizing, when I saw these a couple of patients back then,
Yeah.
in my college where I used to study,
Yeah.
there wasn't a specific oncological setup there.
Okay.
So, even after passing my MD medicine, technically as somebody who has done their post graduation,
Right.
you still are referring those oncology patients to places like Tata Memorial Hospital, to other places,
Yeah.
because the exposure isn't there, the
Yeah.
drugs are not known to us.
Right.
And it's usually the relatives, I used to see the relatives used to be so scared,
Yeah.
and they are looking for answers, and the questions which they would ask me, uska answer even I didn't have
Right.
per se. So when I passed out, I just thought about it and I was like, this is something different.
Right.
We, in the medical field, we keep hearing cardiology, we keep hearing nephrology, we keep hearing urology,
Right.
neurology,
Right. Yeah.
I was like, let me do something different. Let me try to help these patients out.
Okay.
Let me see what we can contribute to the society by just helping, the people who are actually ailing and the people who need support.
Correct.
I'm not saying the person who's been diagnosed with a diabetes does not need support, but
course.
comparatively, it's totally different.
Yes.
And that's what I decided, and then I gave my exams, and then I went to Tata,
Right.
and that's how everything started.
Correct. Speaking of intensity of what this ailment has along with it, a lot of people are psychologically, they need a lot of support, I feel, when it comes to detection and diagnosis of cancer in the first place.
Correct.
And how much you think a psychologist needs to be involved himself or herself in the process of being diagnosed or rather being treated of cancer?
See, now this is a very complex question, because if you see the West, the way
Yeah.
the West has been functioning, the
Yeah.
way America has been functioning, the way UK has been functioning,
Right.
a psychologist, a palliative care specialist,
Right.
all of these guys come together in the beginning. At the time of diagnosis only, everything has happened.
Right.
Okay. But in India, we're doing so great currently, but still there is a lack of resources.
Right.
Treatments are expensive.
Right.
Financial burdens plague,
Yeah.
the entire family,
Right.
no matter whether you're well off, not well off,
Right.
whatsoever. It's not easy.
Correct.
And on top of that, when we add psychologists, when we add everything, it becomes a
Yes.
problem.
Yes.
Okay, financially for the patient.
Correct.
But if you ask me medically, if you
Yes.
ask me this question as a person, then of course I would say yes.
Right.
So here, day to day also, we don't have very good, onco counselors also here.
Correct. Correct.
Like we
Correct.
do, the number is small. We have
Right.
some pretty good guys around.
Mm-hmm.
The number is small, it's not that very open.
Right.
And the doctor is forced to, like it's not forced, like in my case, I'm not forced, but I personally take it, as something wherein if a patient comes to me, I give the patient half an hour, 40, 45 minutes,
Right.
clear the doubts,
Right.
tell them that feel free to call.
Right.
Because, the scenario is what, since 1990s, oncology has evolved quite a bit.
Correct.
Quite a bit.
Correct.
Okay. And at that particular point of time, we did not have drugs.
Mm-hmm.
Okay. And what my parents have seen, they would be like, "Arey, cancer gone."
Right.
Now things have completely changed.
Right.
But people still aren't aware. People still don't know about this change,
Right.
know.
Right.
It's going to take some time.
Right.
Wherein, the entire population knows. It's like TB.
Right.
When we were children, when I was a
Yes.
child,
Yes.
in late 80s, early 90s,
Yeah.
the scenario was like, my mom used to be like, if somebody is coughing, don't go, TB ho jayega, so I don't want to lose my son.
Right. Right.
Although at that particular point of time, TB had started to be cured. It
Correct.
wasn't that TB was a killer machine at that time.
Sure.
But that thing which was there in their head, and cancer is one step above.
Correct.
So it is very important to counsel patients. It is very important to tell them it's not the end of the road. It is very, very important to also, counsel the family members.
Yes. Yes.
Okay, it is not, game over right now. We
Correct.
still can do quite a bit.
Yes.
And I somewhere, down the line, I do believe that this, this perception that people have about cancer, this is the reason why people are scared to come out when they have symptoms.
Correct.
And this is the reason why we diagnose cases at stage 3, stage 4.
Right. Right. Right.
Like, just to share one example,
Right.
I don't want to mention the hospital.
Of
Let's
course.
not make it controversial. Don't want to
Right.
name the
Right.
patient as well.
Right.
I had this one lady, 50-year-old lady,
Right.
all right.
Right.
She came up with seizures.
Okay.
Okay. Admitted under neurology.
Okay.
She used to have recurrent fits whatsoever.
Yeah.
And I just got a neuro reference that maybe, they did a MRI. They
Sure.
saw something in the MRI.
Sure.
They probably said ki nothing else is there.
Right.
Patient is not giving any other histories.
Absolutely.
Okay, so probably it is a cancer of the brain or whatsoever. Till the time I had to literally tell the patient, I had to take the patient in confidence and I had to ask her, do you have any other symptoms? Because
Right.
what I see on the scans does not look like a neurological malignancy.
Correct.
It looks like something has gone from somewhere to the brain.
Okay.
So that's when she said that she had a lump in the breast since the last 2 years.
Okay.
The entire breast has opened up, fungating, bleeding.
Okay.
She's just been putting kapda and kapda on top of it, not telling even her own daughter, not telling anyone. Everyone was shocked. And when I examined the breast, with my team, everybody was shocked. And yes, she came out to be breast cancer, which has spread to the brain.
Ooh, okay.
So it's that lack of awareness. It's like, and when I asked her in detail, like even I met her yesterday, in fact, and I asked her, I was like, how are you doing? She said, I'm doing fine. Things are much better. The wound is healed. Things are looking better. And I just asked her, very casually. Like I asked her, I was like, why didn't you tell us this?
Right.
It's been a year since I'm treating her now. So that patient-doctor relationship has developed. And she's like, I got an idea. I thought it was cancer. And I was just so scared. Because I thought the minute I would go, multiple tests hoga, kharcha ho jayega, so and so will happen. I thought maybe this will heal on its own. I googled things. I tried to put neem ka patta on it. So this is the state, currently.
Right. So what is your approach when it comes to, the moment you find out that this person is hesitant or maybe going to turn into a difficult patient psychologically to handle? So is your approach already into counseling from day one while you meet the patient? And of course you meet a lot of patients in a day. So for you to figure out that this person is going to be difficult, it's going to be difficult for that person to consume the entire scenario of having to go through all this treatment and exertion and all of that. So do you even mention that, okay, let's also, this is an option that you can have a counseling done for yourself and family?
So what I basically do is that when the patient comes up to me,
Yeah.
like right as a new patient, I definitely counsel the patient, counsel the family members, like I said earlier. Now sometimes, like you said, a difficult patient.
Yes.
Sometimes there is a patient who is constantly scared, who is, just creating, an entire atmosphere of sadness at home.
Yes.
And I personally feel that ये जो atmosphere रहता है of sadness at home, it's very difficult because the battle is not of the patients.
Correct.
The battle is of the relatives also.
Absolutely.
The relatives are also going to be going ahead and, going through a very difficult time,
Yes.
but with a smile on their face.
Correct.
And when they realize that all their efforts, imagine you're paying money,
Yes.
you're doing everything for the patient, you're giving the best food, you're getting whatever best possible for someone who you love at home.
Right.
Just imagine this factor, yeah, this scenario rather.
Yeah.
And that patient is forever sad. I have had patients जो 100% curative cases है, but they are also depressed. After getting cured also they are depressed. Why me? So in such cases, yes,
Yes.
counseling does make a difference. Such cases, I do want, somebody like a onco counselor to come in, talk to, because this is not my forte, it is
Correct.
not my specialty.
Correct. Correct.
All I can do is I can show patience, I can, try to answer a trillion questions.
Correct.
I can show my availability, but
Yeah.
I cannot connect with them because that's not my that's not my forte at all.
Correct. Correct. Correct.
So in such cases, yes, we do need them.
So what is the most challenging thing about oncology as a consultant for you?
The most challenging thing as such I can't say, but what I can say is there are certain cases, at times you see, like, I had recently seen one case which had 3 different kinds of malignancies,
Okay.
all at the same time. The patient has a gallbladder cancer, breast cancer, and patient also had, a breast ovarian cancer basically.
Okay.
So ovarian, breast and GB,
Yeah.
all 3 together.
Yeah.
And at that times the most difficult time is to getting the, the apt regimen in, and when you are successful, it also definitely, you also feel good about it. And the
Yes.
other thing, we've already discussed this, which was, the most challenging thing is for the patient, to get the patient, to the hospital and to see, the
Right.
doctor is the most challenging thing.
Right.
Like
Right.
in my family also, if you see, there are so many people, I'm not saying they have cancer, but what I'm saying is so many people, we know sugars are, hovering at 300, you don't even start medications. बोलते नहीं नहीं उधर जाएंगे तो दवा शुरू हो जाएगा, but वो
Right.
दवा अच्छे के लिए है, it's not for
Right.
the
Right.
wrong thing. So
Right.
I feel that's the most challenging thing, to get the patient out, of that cocoon and to come and see the medical professional. If you have any issues, ऐसा तो नहीं करने वाला है कोई भी कि नॉन कैंसर पेशेंट को कीमो दे देंगे.
Correct.
But obvious है.
Correct. Yeah.
So that's what I feel is the
Yeah.
most challenging thing,
So when it comes to cases in terms of there are a lot of cancers as you discussed, and maybe there are certain demographics that you constantly see that there are these XYZ type of cancers repeatedly seen with maybe patients in India or maybe an international setup. What are the most common types of cancer that you've seen often, and what do you think can be the possible etiology for those, if any?
See, India, right? If you are talking demographically
Yeah.
and by numbers,
Yeah.
India is number 1 when it comes to head and neck cancers in the world.
Wow. Okay.
The simple thing is tobacco.
Okay.
Okay, we are not going to make controversial statements,
Right.
but what I'm saying is the industry is still flourishing.
Right.
People are still consuming.
Right.
ठीक है.
Right.
No matter, despite the bans by the government, despite whatsoever, I don't
Right.
know how things are working, whatever is happening.
Yeah.
People are so scared. I said, even when they have symptoms, they don't even want to go to the dentist,
Right.
per se. And when you are chewing tobacco, you are at risk of developing a oral malignancy.
Correct.
We understand, you're addicted, you want to do whatsoever.
Yeah.
Time to time, periodically check to karwa lo.
Right. Right.
ठीक है.
Right.
That also people don't do. So head and neck cancers is number 1, I would
Okay.
say, on the
Okay.
list.
Okay.
Number 2 I would say breast cancers.
Okay.
There is a very great rise in the amount of breast cancers
Right.
in India,
Okay.
in even the younger population.
Okay.
The simple reason being is the lifestyle.
Okay. Okay.
Whatever demographics the West has been seeing, whatever we've been seeing in the West,
Mm-hmm.
the same pattern is going to come here, because that is how we are evolving.
Okay.
Right now, there are a lot of colon cancers in America.
Right.
That will
Right.
happen in India also.
Right.
Okay? The reason being is because of the food that you consume.
Right.
In breast cancer, the simple reason is, I am not going to be sexist, I am not going to be anything, but I am going to say a simple question. Okay? The amount of oral contraception
Yes.
today in the
Yes.
market,
Yes.
if you see the average amount of oral contraception which was consumed 15 years ago and today,
Right.
see the numbers, you will get the answer.
Yes. Yes.
Oral
Yes.
contraception is one of the reasons, why you get malignancies. One,
Correct.
see the amount of physical activity.
Right. Right.
I have a child at home.
Right.
He is active.
Right.
We try to minimize screen time whatsoever.
Correct. Correct.
But the whole point is, he has access to the screen. I
Correct.
will be able to control him for 5, 6, 7, 8 years.
Right.
After that,
After that.
what?
Right.
Like when I was a child, there was no cable.
Right.
Yeah.
Yeah.
Forget Tata, Sky, Netflix. There was
Yeah.
no cable, there was nothing.
Right.
I had to run, because I'm bored at home. I had to run, go to my friend's house, knock at the door, call him out, let's play cricket, even if it's boiling outside.
Yes. Absolutely.
No physical activity.
Right.
Okay, and that time, if you see, even the women, like even the girls rather,
Yeah.
right, they used to come, they used to play, children basically
Yes.
playing together. Now, if you see, even the young girls, or the young boys, they don't want to play. They're
Yes.
playing video games,
Right.
they're playing on the mobile, they're playing on the iPad.
Yeah.
So, physical activity is
Zero.
nil. And I personally feel that going to the gym is good,
Right.
but that is not called physical activity.
Correct.
It is activity, you're
Yeah.
lifting weights, but you're targeting muscles.
Right.
Physical activity is going for a run, physical activity is, playing a sport, physical
Yes.
activity. All these things, are going to, help you
Yeah.
in different ways.
Right.
And all of that in the current trend of all the ladies that you see.
Yes.
OC pills are more, smoking has become more,
Yes.
alcohol consumption has become more,
Right.
late nights have become more.
Right.
Okay. OC pills have become more,
Yeah.
pregnancy has been delayed.
Yes.
Okay.
Yes.
All these factors will combine to breast and gynecological factors, because that is not how physiologically God has made you.
Sure.
You know what I mean? It's
Yes.
not about sexism or anything. I'm
Right.
not saying get married and produce 10 children.
Right.
But what I'm trying to tell
Yes.
you is basically, you need to be physically active.
Right.
You need to do any which ways. If you're planning to have a child at 39, might as well get it at 30, no?
Yes.
वही होने वाला है. तभी आप 1 साल ब्रेक लो कि अभी 1 साल ब्रेक ले लो.
Right.
But you lower your risk from all these diseases. OC pills, one of the worst things,
Right.
These are the main things. And to conclude, like I said, colon malignancies.
Correct.
All the processed food which America used to eat,
Yeah.
okay, or still eats,
Yes.
donuts say, coffee say, whatever it is,
Yeah.
everything has come here.
Correct.
What was there in the 90s? I don't know how many people are watching us who are from the 90s or 80s.
Right.
I remember the first time I ate a mozzarella cheese pizza, and I was so fascinated because the cheese was just never ending.
Yeah.
Something like that.
Yeah.
At that time, there was just regular, your vada pav, sev puri, bhel puri, all of that. Everything is, vada pav is freshly cooked. It's not
Yes,
processed.
yes.
It's not frozen.
Yes.
Okay, idli is not frozen.
Right.
Dosa is not frozen. Pav
Right.
bhaji is not frozen.
Right.
It's unhealthy,
Correct.
but it's not frozen. It's
Right.
now you have ready to eat meals.
Yes.
You have donut on the go. You have a sandwich which is made, aesthetically and kept in a freezer from 6 in the morning till 8 in the evening, till the time you just walk out there and you consume it.
Yeah.
You know
Yeah.
what I mean?
Yeah.
And wo bhi jo sandwich bana rahega, that chicken also will be frozen.
True.
French fries are frozen now.
True.
I remember when we were children, I had to tell my mom
Yeah.
if I wanted to eat French fries, right?
Right.
My mom would go take up, the potato, make those slices,
Right.
फिर उसको पानी में डुबो कर रखेगी,
Right.
फिर जब मैं आऊँगा तब वो गरम तेल से तला जाएगा.
Right.
If I tell my wife right now, I'm not saying bad about my wife if she's watching this, but yeah, but she would
Yeah.
just tell my cook, like, you know, we've got some frozen.
French
This thing
fries,
makes
yeah.
the job easier.
Yeah.
Finish it.
Yeah. Yeah.
So processed food has just increased. I didn't even know there was a mustard sauce till the time I was 12 years old.
Right. Right.
I didn't even know mayonnaise probably existed.
Right. Right.
I just knew tomato ketchup.
Correct.
That was the only condiment which was processed, which I was taking. Not condiment or whatever you call it.
Yes.
It was the only thing which I
Sauce,
was taking.
yeah.
Sauces, yeah. So that's one of the things I feel.
So the environment and the lifestyle has done.
Yes, pollution, lack of exercise, late nights, you sleep anytime, you wake up, such a fast-paced life, your cell phone.
Yeah.
I can't crib about the cell phone because my profession demands it, but everyone else,
Right. Right.
you can just switch off your phone and sleep for 8 hours. Nothing
Right.
is going to happen.
Correct.
The world functioned absolutely well
Yes.
before all of this came into the picture.
Correct. Correct.
Now, even if you're in the bathroom, phone rings, you're taking a shower, phone rings,
Yes.
you come out, just take the phone, try to talk, your sleeping phone is next to you, phone
Yeah.
rings, alarm is on the phone.
Yes.
What happened to the alarm clocks, which you could just
Correct.
tap them, right?
Yes. Yes. Yes.
So, that's what.
Okay.
It's all radiation, it's all pollution, radiation, everything today.
So then, like how our habits changed, the way we treat patients also changed. There were a lot of technology advances, and if I may ask that the treatments and protocols that we followed, let's say 10 years back, today are there any advancements that we look forward to that may help us diagnose early or treat better?
Yes, so back in the days, the medications were very limited. Now
Correct.
we have immunotherapy.
Yes.
And immunotherapy is something which, when it starts working, it works like magic.
Okay.
It's magic. Patient has no side effects.
Yeah.
Patient is doing well. Patient is, having no symptoms at all. And patient is living a normal life, stage 4 patients also. For those patients whom it works.
Okay.
So definitely things have changed. Our, the way we looked at patients, the way we treated the patients has changed.
Right.
The advancements in terms of screening
Yes.
specialities like PET scans and everything has come up, which wasn't there earlier.
Right.
Next generation sequencing has come up, which tells us the molecular biology of a tumor.
Yes.
All these things
Right.
have per se come up in the recent years.
Yes.
So it's but obvious. See, humans are going to evolve.
Correct.
With
Correct.
everything we evolve, and this is how science is, and this is how we are, right? This is my sort of philosophical take on it.
Correct.
Right? Whatever I do,
Mm-hmm.
ठीक है, if I think that is right, and if
Yeah.
I'm enjoying it,
Right.
उसका जो भी side effects होगा, I will try to cope it up with something else.
Correct. Correct.
So today, whatever is happening in the world, radiation, pollution, this, that, whatsoever,
Yeah.
ठीक है, science is coping up with it. We'll give you better screening, we'll give you better this, we'll give you better treatment.
Right.
This is what we are doing. But the
Right.
best way out of all of this is just one thing, which is stay healthy.
Correct. Correct.
Stay healthy, don't eat processed food. Make sure you take some time out for exercise. Get rid of the phone, screen time. आप थोड़ा कम करो before telling the child,
Absolutely.
this is the thing.
Yeah.
So that's what I would say. So quite a bit of advances have come. Immunotherapy has just changed everything, and
Right.
sooner or later, I personally feel there will be a point of time wherein surgery will be replaced by immunotherapy.
Okay.
Many surgeons agree to this, many of them do not agree with it. It can be a debatable topic which we can leave for some other time, but
Yes.
that's what is happening. Where surgery and where things were coming to a standstill 10 years ago, what I've seen in the last 10 years, now that's where the game starts,
Correct.
So that's the thing.
So basically, can immunotherapy replace chemo and radiation? Or let's say specific cases may require chemo still with immunotherapy as a
Yeah.
treatment?
That has already started happening.
Okay.
That has already started happening.
Okay.
Targeted therapies. We
Correct.
give in breast cancers, we give HER2 positive breast cancers, we give targeted therapies. Along with that, we give chemotherapies.
Okay. So immunotherapy basically can be combined by a protocol with chemotherapy. Is
Absolutely.
So, if I may ask, how do you explain immunotherapy to a layman?
It, in a layman's term, I'll tell you something. It is basically, let me put this in a very nice, simple way.
Right.
ठीक है? There are three ways,
Hmm.
ठीक है, to kill your cancer cells.
Yeah.
Number one is, absolutely, it's like dropping a bomb.
Yeah. Yeah.
Good cells die, bad cells die, everybody,
Yeah.
it's gone.
Yes.
That is chemotherapy.
Correct.
The other way is, where the tumor cells have infiltrated, you have targeted therapy.
Correct.
Like sniper, they will shoot only and only the cancer cells,
Right.
leaving the good cells.
Right.
The third is, which is very, very new and which is very, very nice. We've been hearing it since maybe half a decade now, which is immunotherapy.
Right.
Immunotherapy is something wherein you change your entire immune system.
Right.
So, if there are people who are coming and who are causing a ruckus somewhere, like these
Yes.
cancer cells, like be it terrorists, be it whatsoever, in the same
Yeah.
example I'll give you,
Yeah.
where is the funding coming from?
Correct.
What is this happening? Where are these guys coming from?
Right.
Block all these.
Right.
Automatically they won't come. So, it's the change in your entire immune system.
Right.
Like your immune system to certain cancer cells is fighting in a particular way, causing the cancer cells to grow and grow.
Correct.
Okay, and your poor immune system is taking the beating. Now it's going to change. We're going to fight the cancer cells from the other way.
Right.
When you change your entire immunological response of the body,
Yeah.
that is how the immunotherapy works.
Okay. And what about the fitness to administer immunotherapy? Is there any fitness to administer such therapy?
Not really. Not really. Like obviously, if a patient is on a ventilator, I'm not going to. I know,
course.
because the only drawback of immunotherapy is it takes weeks for it to work.
Okay.
So if we see a patient who is on a ventilator,
Yeah.
I'm not saying patient will, pass away.
Yeah.
I don't want that.
Yeah.
I want everybody to be alive.
Right.
But, as a doctor,
Yes. Yes.
you know how much time this patient has. You're
Yes.
not God.
Of course.
But from your experience, you have an idea. And if I know that the patient is already on the last leg on the ventilator
Yes.
with 70% saturation, it's a
Yes.
matter of hours or days.
Right.
What is the point of wasting the money and drug on a patient?
Right.
If the relatives want, we still go ahead with it.
Sure.
Unless there are certain patients like lymphomas or certain cancers which are highly susceptible to chemos,
Right.
highly susceptible to, immunotherapy.
Right.
These patients, even if they are on the ventilator, I will go ahead and I will give it.
Right. Okay. Makes sense. Having asked you about immunotherapy, I had something in mind about genetic profiling. What is your view on genetic profiling per se?
It's very, very essential.
Yeah.
Like genetic profiling in the West, right? is many a times it's done before you even initiate treatment.
Okay.
Yeah. Like certain breast cancers,
Okay.
certain colon cancers,
Okay.
they all have a genetic lineage. Prostate malignancies,
Okay.
ovarian malignancies. Okay. So breast cancer mein there is a gene known as BRCA.
Okay.
BRCA1 and BRCA2. It's a blood test,
Okay.
simple blood test. So if there is anybody who is a young patient,
Mm-hmm.
right, who has got breast cancer, anybody who has daughters or siblings, sisters, you can always get a BRCA done.
Okay.
First for the patient, if the patient is positive, then for the siblings, and then for the daughter or whatsoever.
Okay.
Now, BRCA positive does not mean if there is a patient, let's say if there is a patient X right here who is BRCA positive,
Right.
does not mean she is going to get breast cancer.
Right.
She is at a higher risk of getting breast cancer.
Okay.
Also, the other advantage for the patient when the patient is BRCA positive
Yeah.
is that you can give PARP, PARP inhibitors. These are just tablets and they will control the genetic mutation of the malignancy, and in layman's terms rather.
Yeah.
Alright, they will control the malignancy
Right.
even in a stage 4 malignancy if the patient is BRCA positive
Okay.
for a stipulated amount of time or whatsoever, and the patient is free from chemo, and it gives you one more bullet in the gun basically.
Right.
Therapeutically also.
Right.
So the advantage of the blood test is not only just diagnostic, it's also therapeutic.
Okay.
And if you go in, say for example, colonic malignancies, you do MSI, MMR,
Okay.
okay, which is microsatellite instability, okay. And these things, if they are positive, there are certain syndromes which are going on in a
Right.
family
Right.
since a while, which are, you know, the predisposing factors to the
Right.
colonic cancers.
Okay.
Okay. And if the patient is MSI MMR, you know, what do you say, positive, then you can always end up giving immunotherapy.
Okay. Okay. Okay.
All right, and these immunotherapies will work really well. You can do MSI MMR in gynecological cancers also.
Okay.
The same way, coming to prostate cancers, you can do something known as HRR on the prostate tissue.
Right.
All right, if HRR is the tissue form of BRCA1 and BRCA2,
Right.
which is, you know, there in male patients who have prostate malignancies, if they are positive,
Right.
HRR positive, you can add certain medications, PARP inhibitors, etc.
Okay.
You know, so that's what I feel. So I feel genetic testing is important, and it's growing by the day.
So this is done after detection or can be done pre-detection as well?
Pre-detection, if you have a higher family history, like if you say, for example, if there is a woman
Yeah.
who says my mom had breast cancer, aunt had breast cancer,
Yeah.
sister had breast cancer,
Yeah.
get a BRCA done.
Okay. Okay.
We screen you earlier.
Yeah.
You know, if there is somebody who has 3 colon cancers in the family,
Yeah.
3 stomach cancers in the family,
Yeah.
then you do these things probably. GI cancers whatsoever. So that's where you can do it. But obviously these syndromes are not that common.
Okay.
Breast cancer mein to fir bhi mil jayega, but you know, the syndromes which cause colonic malignancies and all are not very common. So that's what.
So what are the screenings that you may recommend to people who like a general health checkup when let's say cancer screening? What are these investigations which are termed as cancer screenings early on?
See, like I said, every woman, right,
Yeah.
should undergo a mammo once a year.
Okay.
ठीक है, post, you know, 36, 37, 40, let's keep a cutoff age maybe, you know, at least. ठीक है, because earlier if I just tell patients to, they are not going to do.
Right.
So mammos once a year should be there, not more than once a year.
Right.
Again, you can end up going ahead with certain tumor markers with your routine tests.
Okay.
Like PSA levels, CA15 by 3,
Right.
CA19 by 9, CEA, CA125. These are all blood tests. But again, if screening protocols come out to be negative, these blood tests come out to be negative, it's not going to be surely that you don't have malignancies.
Okay.
Like for example, CA19 by 9 is a marker for pancreatic cancer.
Okay.
But ऐसा नहीं है, if I take 100 patients, सबका CA19 by 9 will be elevated.
Okay.
60-70 का रहेगा, 20-30 का नहीं रहेगा.
Right.
So screening for breast, I will definitely say mammos.
Yeah.
I will tell you for gynecological malignancies, pap smears.
Okay.
For men, you know, post 45, 50, get a PSA done regularly.
Yes.
You know, as a blood test, because PSA is accurate.
Yes.
PSA तो बढ़ना ही है. So certain cancers you can target, but not all cancers, obviously.
Okay.
And certain blood cancers like, you know, leukemias and stuff like that, automatically on a simple CBC will also tell you.
Oh.
When you see the WBC counts increasing, abnormal cells coming in, you will know.
Okay.
So that is the scenario.
Any myths or misconceptions in cancer that you've heard and you've thought that you need to clarify those?
That quite a bit, yeah. Quite a bit of myths and misconceptions that I have seen. India, I have to say, and you know, I can agree, even the people who believe in the myths will agree with this statement.
Okay.
India is one country wherein everybody wants to be their own doctor without a degree, you know, without a degree. Everybody, they have their own scenarios.
Yeah.
Yeah. To make, you know, things light, I'll just tell you, you know, a light-hearted moment wherein my wife herself, she's not a, she's not a medico per se.
Yeah.
But she has her own, you know, scenarios.
Right.
Like she might tell you probably, you know, that you have loose motions, eat a burnt toast. You know, the loose motions will go. And it is something which I have to eat a burnt toast. Yeah, I have to stay in the same house. Yeah. So, you know, there are these things like certain, like if you ask my mum, for example,
Right.
she'll tell you, oh my God, you can't have nariyal pani raat ko.
Okay.
Gas ho jayega subah.
Right.
ठीक है.
Right.
Then I have certain friends who will tell you that, you know, the thing is you should not have एक what was that? You should not have something because उसकी तासीर ठंडी होती है, उसकी
Right.
तासीर गर्म रहती है.
Right.
I don't believe in these things.
Okay.
Okay. But I have to live here with my friends and family.
So you abide by
So
it.
I have to just put my head down and I'll be like, ठीक है नारियल पानी कल पी लूँगा सुबह में.
Right.
मन आज हो रहा था लेकिन कल पिएंगे सुबह में, ठीक है?
Right.
It's like that. So myths and facts about cancer, coming to that, there are so many myths right now.
Yeah.
Like there are people who will tell you stuff like, let me tell you something. People will tell you something like, you eat fruits. You're taking chemotherapy, you should have fruits.
Wow. Okay. That's
Okay.
new. Okay.
Have dragon fruits. Dragon fruit
Okay.
is the best fruit. You will cure cancer. I have so many patients. Tata Memorial Hospital के बाहर dragon fruit ऐसा, see, you'll see this guy who will
Really?
be selling. Yeah. You'll see it. ठीक है. And at least he was there when I was there 10 years ago. I don't know now, but yeah, but you will always see it.
Yeah.
Wherein technically, if you ask me, chemotherapy causes protein loss from your body. You
Right.
need proteins.
Yes.
Scientifically, the body needs proteins
Yes.
because you are losing proteins.
Correct.
ठीक है, तुम
Yeah.
फ्रूट खिलाकर फाइबर दे रहे हो पेशेंट को, मल्टीविटामिन्स दे रहे हो जो एक पिल भी कर देगा.
True.
ठीक है, that's one.
Yeah.
Secondly, people will come up to you and people will tell you certain naturopathy or whatever. There are people who are propagating, so I'm not going to go against that.
Yeah.
But the American Society of Oncology, European Society of Medical Oncology do not believe in these things.
Right. Right.
ठीक है, so there are so many things that people will say, if I follow a X amount of diet,
Right.
it's a cancer curing diet.
Oh. Okay.
ठीक है, it has this, it has that.
Right.
People will call me up and they'll say, we'll have ABC juice,
Mhm.
we'll have wheat grass in the morning,
Right.
we'll do this, we'll do that, it'll take care of cancer.
Right.
So that's one.
Right.
Third myth about cancer, what I have personally seen in patients is, in Tata I used to see, people would go to these, I don't know who are these people, whether to even call them Veds or what is
Right.
would be something, I don't want to insult the Veds.
Right.
Because these guys would come, there was this one lady who came up to me, 25-year-old gallbladder malignancy, came to me in TMH about 10 years ago, I'll never forget it. Complete abdomen is bruised, yeah. They have put candles on her, tried to burn the cancer, I don't know what they've tried to do. She's come with a full-blown jaundice. Okay, the other thing is people combining allopathy with Ayurvedic medicines.
Which was my next question. Yes.
Yes, people do these things with homeopathic medicines. You believe in homeopathy, you take homeopathy. I'm not against it.
Right.
Right? You
Right.
believe in Ayurveda, take in Ayurveda.
Right.
But don't try to take 3 things best of each. You know
Right.
what I mean?
Right.
It's simple. It's a simple rule. You like thumbs up, you take thumbs up. You like Coke, you take Coke. You
Correct.
like Mirinda, you take Mirinda. Whatever
Correct.
it is.
Correct. Correct.
Although just the thing is that allopathy today is the only thing which the West acknowledges as something which is going to take care of the malignancy.
Right.
The other myth which I have literally seen with a lot of people, right? A lot of people which I have seen is people say, ज़्यादा बाहर का खाओगे ना कैंसर हो जाएगा.
Okay.
ठीक है. The same way बोलता है, अरे बहुत मीठा खा लिया ना अभी डायबिटीज हो जाएगा तेरे को.
Right.
नहीं, डायबिटीज है तो शुगर बढ़ेगा.
Right.
बाहर का खाने से डेफिनेटली कैंसर हो सकता है.
Right.
बिकॉज तुम अगर वो जहाँ से खा रहे हो, इफ दोज गाइज आर यूजिंग
Preservative.
not preservatives, if those guys are using, like I told you, processed food,
Correct.
frozen food, yes,
Yes.
you're at a higher chance.
Yes.
But अगर मैं कहीं पर जाकर, for example, if I'm eating a idli and a sambar,
Yeah.
I'm not going to get cancer.
Right. Right.
But this is the myth that people have.
Right.
Same guy who's going to be telling you about this myth is going to be going, while we walk out of the studio, while we go out, you might see the same guy who's gone home and told the same thing to his kids
Right.
and smoking a cigarette outside.
Right.
ठीक है?
Right.
The same guy will be going out and probably having 2 drinks in the night.
Right.
And the same guy will probably be having, chewing tobacco.
Right. Right.
So, there are so many, myths are abundant. What I just want to say is, whatever you do, just leave the job to a medical professional.
Absolutely.
ठीक है? I don't know why medicine is like this in India.
Yeah.
Like, see, think about it, right? If somebody has to approach a lawyer for a legal case,
Yeah.
right?
Yeah.
Lawyer जो बोलेगा मैं सुनूंगा, मुझे कुछ
Correct.
भी नहीं पता है.
Correct.
वो बोलेगा सर आप इधर साइन करो, जेल जाओगे, मैं साइन कर दूंगा उधर. It's only, with medicine,
Yeah.
that people are like, like my friends, my school friends, my close friends, they had such a bad cough. I said, here, take this antibiotic.
Right.
You need it.
Right.
You spread it to your mom and dad. We don't even
Right.
know if this is COVID. COVID का भी test नहीं करना है.
Correct.
करना ही नहीं है test.
Correct.
ठीक है. So when I tell it to these people, right, that you have, they're like, अरे antibiotic. अरे my body cannot take antibiotic. Your body can take, a binge drinking night of Saturday.
Yes.
Of beer. Your body can take, eating mutton biryani from the roadside.
Yes.
Your body can take, probably breathing the toxic air which is outside.
Yes.
ठीक है. Your body is working on 1 hour of sleep.
Yes.
Because despite you knowing, you decided to watch a show on Netflix till 5 in the morning, knowing that 7 o'clock को office है.
Right.
या 7 o'clock को school से बच्चे को उठाने जाना है.
Right.
या pick up करने जाना है,
Right.
rather. Your body is taking all of this, but it will not take that one pill,
Yes.
It's antibiotic.
Yeah.
The other myth is you give a pill. Half the patients come up to me in the beginning. पिल खाया बाहर जाते हैं कितने टाइम तो ऐसा हो गया है कि मैंने like कोई कीमो पेशेंट हो या कोई मे बी आई एम टॉकिंग not chemotherapy, rather the patients, when I was doing my medicine, I give them a pill, they walk out.
Yeah.
10 minutes later, taken the lift, come back up, बोलते कि अरे डॉक्टर मैंने बोला था ना आपको, अभी देखो मेरे को चक्कर आने लग गया है. BP normal, everything normal.
Psychologically.
Yeah. And that is
People
what
have made up their mind, I guess.
Yeah, which I feel is okay.
Yeah.
And now with ChatGPT and Google,
Wow, they are doctors.
they are doctors. Google is going to show you death for everything.
Yes.
I can prove it. Even if I write I have a headache since 4 days, they will, brain tumor तक diagnosis में आ जाएगा वहाँ पर.
Yeah.
So it's just funny, but it is what it is.
Yeah.
You can't change it. All you can try to do is just tell people, ठीक है, Google कर लो, ये कर लो, लेकिन अगर कोई, if there is some guy who has studied for 10-15 years and he's giving you one pill, which you don't think before, eating pani puri outside, कि वो पानी में क्या था कि जिसके कारण जुलाब हुआ.
Right. Right.
So
Right.
that's one thing which is there.
Right.
So a lot of myths, I would say.
The next question is for you, basically, that with all of this chaos, with all of this stress, I know right now when you came here, you managed an emergency and you came here.
Yeah.
So what keeps you grounded? What keeps you sane? What keeps you level-headed?
See, frankly speaking, one thing I would definitely say is that oncology is depressing.
Yes.
It is. Job satisfaction is very minimalistic.
Right.
ठीक है, because most of the patients in our country are diagnosed late.
Right.
And many a times, and it gets me paranoid too at times,
Right.
Many a times, I just, there was this one thing, I was just sitting once, in my OPD at Wokhard,
Yeah.
between patients, and it's a nice afternoon.
Yeah.
And I was just wondering, I saw back-to-back really bad stage 4 patients, and I was just wondering, and uske beech mein somebody came and they said, thank you doctor for being there, thank you for everything that you've done, but mama passed away.
Right.
Last night peacefully, but she remembered you even during her dying moments.
Right.
She said thank you to Dr. Jimmy, this, that. I said fair enough. And I just realized, and then there was another guy who walked in with his mum, the stage 4 malignancy, obviously something else, not the same. And it just got to me wherein it just feels so weird, that you sit on the same chair, you're sitting there,
Yeah.
and patients come, some patients you treat, some patients you don't.
Yeah.
So it is depressing,
Yeah.
but the only way I manage that depression, also it gets me paranoid. Like I had a mouth ulcer, for 3 days. I have checked my mouth 5 times a day just to see if it is oral cancer or not. I don't chew tobacco, I don't do anything, but still, just to be safe. If I have loose motions for more than 3 days, I contemplate maybe I'll go and get a colonoscopy done. This is just a joke, but yeah. Right? So, but the satisfaction you get, when one patient makes it out alive.
Yeah.
Recently we've, felicitated so many cancer survivors at Wokhard.
Right.
Yeah, we gave them trophies. They had won the battle.
Right.
90% of them were the guys who came at the instance of the first symptom.
Wow.
Like, strong-willed guys, जो है करना है.
Correct.
Treatment लेना है.
Right.
But the satisfaction as a caregiver that I get, and when I was, standing on stage and giving them the trophies, and that smile, because
Yes.
I have seen the transformation from, the lady becoming so frail to losing her hair,
Right.
to winning the battle against cancer, to looking more prettier than ever.
Right.
All right, even at the age of 65, 70, you know what I mean?
Right.
Absolutely healthy,
Right.
and the charisma with which she would carry herself to the stage, because she knows, she's won the battle.
Correct.
She knows she's a survivor.
Correct.
And then when somebody gives you the credit,
Yes.
that keeps you going for quite a bit. I feel that is the biggest victory.
Yeah.
But many a times we have this conversation, yaar, ke like sometimes even in the beginning when I was in Tata, so many patients, yeah, and I used to think that I was better off doing MD medicine. वो satisfaction था, malaria के साथ patient आया, ठीक होके घर चला गया.
Right.
Diabetes के साथ आया, बोलता डॉक्टर शुगर कंट्रोल में है.
Right.
Thank you, nobody like you. Yeah. Here it is just like chaos. People, so. But now, gradually, when patients started getting better, that thing, that feeling is very, very important, I feel.
I'm sure.
It's a great level of accomplishment. It's a great level of joy. Like my family members, they just know that somebody has survived just by the way when I walk into the house. I don't share my stories with them because everybody is a non-medico. I don't want to bore them or scare them.
Right.
And I don't want my son to, grow up saying that my father is a doctor. My wife sometimes scares him that daddy will give injection. Don't do that.
Right.
Yeah, don't do that. He should just have his own father. That's it, nothing else.
Yes.
And that satisfaction, but from within which you have.
Yeah. Yeah.
That is what keeps you going, I feel.
Amazing. It's like the patient feedback is the fuel to your
Absolutely. Patient feedback and if the patient is cured, nothing like it.
nothing like it. Exactly.
Nothing like it.
So, what message would you like to give those who are currently being treated at the advanced stage and to the ones who are resilient to treatment and are not willing to even take help?
So for the patients who are undergoing treatment, be it if they are curative or they are palliative or whatsoever, my message is very simple. You need to keep fighting.
Right.
Yeah. Your family is always there to support you.
Yeah.
Doctors are always there to support you.
Yeah.
No matter which oncologist you go to, no oncologist would want anything bad for the patient.
Right.
Right? And you have to keep fighting and just hang on, because every day something new is coming up.
Right.
Many a times we see advanced cases also responding phenomenally well and living a very, very good normal life.
Yeah.
So what I would recommend, rather than being depressed, rather than feeling sorry, make most of the time, and do everything. There are no, like restrictions on anything.
Correct.
All right, you will just, even if आज मैं immunotherapy देके किसी का life से for example 5 years से बढ़ा दूँ, 10 years से बढ़ा दूँ, जो भी करूँ, ठीक है, 4 years से बढ़ा दूँ, whatever it is.
Right.
But for 4 years, if the patient is going to be depressed and sad, there is no point, right? There is no point. The whole point is that, acceptance is important.
Yes.
It's difficult, but it's important. But at the same time, that's the time you should be feeling happy that you have a family who is backing you up. You have a doctors, the nursing staff who's backing you up,
Right.
And try to do most of it.
Yeah.
For those patients who are on palliative, but there are certain patients on curative. For those patients who are on curative treatments, it's a phase.
Yes.
It's going to pass. It's like you just think you fractured your leg.
Yeah.
It'll take 4 months to heal, 2 months of physiotherapy, then you'll walk.
Yes.
6 months में तो सब हो ही जाएगा, सब treatment वगैरह. Rather than being depressed, rather than anything, to these guys I would say sit down, watch Netflix,
Right.
do something.
Right.
Because once you are okay, your office is going to call you,
Yes.
your duty is going to call you.
Yes.
All the love that you are receiving from
Right.
all the people around you
Right.
will reduce, because अभी तो ठीक हो गए,
Right.
ठीक है, अभी तो ज़रूरत नहीं है.
Right.
So let them pamper you, enjoy the pampering.
Yes.
It might come with a little bit of suffering. You might feel a little weird that why me whatsoever.
Yeah.
But it's a phase, it will go away.
Right.
And for those patients who are not coming up, I will definitely say please come up, because you never know how many of them will be completely curable patients. and it would just be a phase for them.
Yes.
You're running away from the phase and giving up your life. That's a very, very bad business deal.
Right.
And if anybody is a MBA or done commerce, please think about this deal,
Yeah.
It's a very bad deal.
Right.
At least screen yourself, at least come, and for all the normal patients, normal people also who are not patients, if you have any symptoms,
Yeah.
if you have any, stop Chat GPT, stop Google. Do it, meet a doctor, do it if you want to.
Yes.
But don't rely just on it.
Correct.
It's a AI technological tool which whatever I type, if I type 5 hit words, those will also show up.
Right.
So what I feel is that those guys, please just go to the doctor. If you think कि नहीं डॉक्टर को मिलेंगे खर्चा हो जाएगा ये हो जाएगा, it is for your benefit.
Yes.
Because you have a tumor, because you have a lump, because we see something inside your mouth, we are getting OPGs and CT scan of the neck done.
Correct.
नॉर्मल आदमी को कौन जाके आज बोलता है जब आप हेल्थ चेकअप का पैकेज लेते हो, nobody goes up and says कि CT scan free.
Right.
Nobody is going to do that.
Right.
Yeah, so I feel for all the people who are normal also, they should come up and they should meet and be open to seeing doctors.
What's the future of oncology looks like to you, maybe 10 years from now?
It's looking very bright. Every day we are seeing new drugs coming up. Every day we are reading about new trials. Like when I left TMH, when I left Tata Memorial to get into private practice, at that particular point of time, the amount of drugs and the amount of drugs now, it's been what, 10 years?
Yes.
लाइफ चेंजिंग थिंग्स. तभी तो हमको पता भी नहीं था कि ये सब इम्यूनोथेरेपी, MSI, MMR, ये सारा टेस्ट कर सकते हो, ब्रैका, इन नेक्स्ट जनरेशन सीक्वेंसिंग तक बातें चली गई है अभी. ठीक है. So sooner or later, I feel immunotherapy is going to be the scalpel of the medicine doctor rather than the surgeon.
Wow.
Trust me on that. And the day is not far wherein probably in the next 10-15 years we would be able to probably deal with stage 4 cancers also, and the patient would be living probably a normal life. Like diabetes is not the end of the world.
True.
TB is not the end of the world anymore.
True.
HIV is not the end of the world anymore.
Absolutely.
So hopefully that's what I think, and I see oncology as a very bright future. So for sure that's what I feel.
Even leukemia, you think? In leukemia?
Yeah, leukemia, there are different types of leukemias, 4 types of leukemias. So already if the patient has chronic myeloid leukemia and all, patient is living a normal life for years and years and years.
Okay.
The other ones also, if you see, there are patients wherein patients are going into remission, coming back, going into remission.
Okay.
It's going on.
Okay.
It's an ongoing process. It's not like the end of the world. It's not like how it was in the 90s.
Yes. 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 Those transfusions and those,
It's not like that.
Yeah.
So
So immunotherapy, you think, is the future of?
absolutely. I won't be shocked if there is some other new therapy also which comes up along with immunotherapy.
Wow.
Yeah, and sooner or later, surgery, I feel, will be replaced by immunotherapy. In most of the cases, not in everything, but yeah, that's what I personally feel. Right? People may agree, may disagree to it, but I'm talking about the future, not right now.
Okay.
But let's see how things work out. Until then, it is what it is, and
Sure.
we have quite a bit of treatments, modalities available even today. I feel so.
Amazing. Thank you so much, Dr. Jimmy. It was really
Thank
great
you. Same
having
here.
you.
Same here,
And
Jagruti. Thank
thanks
you.
so much for your time. I really appreciate, and I'm
Thank you.
really glad that I have someone like you to back on for any such questions. Thank you so much.
Thank you so much.
I hope a lot of concerns may have been put to rest today. Many more such podcasts coming your way. Thank you for listening. Until next time, take care.